Good morning, everyone. And today our topic is diabetes mellitus, and it's a very, very, very important topic. Why? Because diabetes mellitus is present. It's like the prevalence of this condition is too much. Many people are diabetic. So, of course, like diabetes is a big topic, and no one can cover it in 1 hour. You can say rather it needs I think more than 10, 20 lectures, but I will try to cover it in 2 hours time or two lectures. So talking about diabetes, what are the objectives of this lecture is to able to define what is diabetes mellitus, or then we will talk about the classification of diabetes mellitus. We will be discussing about the clinical predisposing factors, then clinical features, and then we will be talking about what are the drugs which are used or how we can manage diabetes mellitus. Not forgetting, like we are also going to discuss the complications, okay, of diabetes mellitus. There are some short-term complications. There are some long-term complications. So, of course, like we are going to discuss them now. Okay, so remove all this. I'm going to write that down again. WHO says that there is around 250 million people uh, in the world who are suffering from diabetes, okay, having diabetes. And now, see, the important thing here, 450 million is too much, by the way. Um, for example, if we will take the world population as 7 billion, so which is 7,000 million, so you can see like it's a big percentage of people who are having diabetes. So that is like what WHO says now, predict now. Of course, like it's a prediction or calculation based on the studies. But for example, in 1980, there were like just 100 million people at that time. Of course, like at that time, the world population was not like 7 billion, not even 5 billion, by the way. But still, like at that time, it was a huge amount. One more thing is diabetes mellitus have two types, type 1 and type 2. Like in type 1 there is complete absence of insulin, whereas in type 2 there is uh, the insulin is there, but you can say it either it's not enough for the body, or you can say like either the resistance of like the body is resistant to insulin. You are having insulin, but your body or the body cells basically don't respond to that insulin. So that is type 2. 90% of the cases in the world is of type 2 diabetes mellitus, diabetes uh, patients, okay. And again, WHO says like males are equally affected as females, though there are studies which says like males are more affected, but overall you can say males and females, they are equally affected. And of course, uh, due to complications of diabetes, many people uh, they die every year, okay. According to one study, around you can say 1.5 million people, they die each year, okay. uh, Many people, they die every year, sorry, I forget die here, they die every year due to diabetes mellitus, okay. So of course, like it's a huge number anyways, if the people are dying. And most commonly, the continents or the races which are affected is Asians or Asia and Africa, okay. uh, and much of the, what you can say, the causes of diabetes is due to uh, you can say sedentary lifestyle. And like previously, like before the industrialization of this world, people, they used to work, you can say, uh, physically. There was more physical work, okay. um, Farming was there, and everyone have to do some sort of physical work to survive. But nowadays, like the jobs are changed as well. People have you can say more like sedentary lifestyles, and very few people, they do exercises. And also, one of the thing is food. That is, nowadays people are taking, what you can say, high calorie, but in reality that is uh, nutrient poor diet. Okay. Like, you can say the fast food, for example. Okay. So nutrient poor diet, and for example the fast food. So that's one of the reason. This one is like increasing too much. So yeah, we will discuss diabetes, and to understand diabetes, of course, we have to, you can say, understand how the thing goes, and I will show you something here. Um, all the game starts from insulin, and insulin is produced by the beta cells, which are located in the pancreas. Okay. Pancreas releases, insulin and glucagon, though it releases other things as well. It have both exocrine and endocrine functions, but right now we are more concerned with the insulin. Okay. So what insulin do, whenever the insulin is released, the body cells started taking more and more glucose. Okay. And what is the effect of insulin in the liver? That liver takes up excess glucose and store it as glycogen, or simply insulin decreases the level of glucose inside the blood, uh, because the glucose will start entering inside the cells, and the liver is going to store that glucose in the form of glycogen. Simply speaking, okay, one thing, exercise, whenever we do exercise, our cells are not dependent on insulin for the glucose entry. Like, as soon as you will start doing exercise, the glucose which is in your blood will start entering in your cells. Okay. So otherwise, like, whenever you are not exercising, your body need insulin. Okay. And insulin is released whenever the blood glucose level is increased. Insulin is released, and insulin basically decreases the blood glucose level. What's going on? See, the blood glucose level is going down once the insulin is released. Okay. Or decrease in blood glucose level will occur, which I'm talking about. Okay. And when the blood glucose level will go down, what happens again? There is alpha cells in the pancreas which produces glucagon, and the glucagon have this exact opposite action as the insulin have. See what glucagon is doing? It is letting the liver to release the glucose into the blood to increase the blood glucose level, and which will increase the blood glucose level in the blood, and which will again let the pancreas to release insulin. So like, this is how the cycle runs. Okay. Or you can say this is the easiest simplified way to understand the function of insulin as well as the function of glucagon. Both have opposite functions. Insulin decreases the blood glucose level, glucagon increases the blood glucose level. So now, uh, what is diabetes? Simply, first of all, we are going to go on to the American Diabetic Association definition of type 2 diabetes mellitus. See, they say it is a metabolic disease characterized by hyperglycemia. Hyperglycemia means what? Like, the blood have more glucose, resulting from a combination of resistance to insulin action. Like, what happens, by the way, here is, like, insulin is there, but your body cells, they're not responding to that. So that is like your body cells become resistant to insulin, uh, and an inadequate, like, or the insulin level is not much. Okay. So simply, what is important here to understand is, in diabetes mellitus, type 2 one, type 2, there is insulin, but either the levels are low, or either there is, what you can say, the body is resistant to that. Okay. So see, uh, Type 2 diabetes mellitus involves two primary pathogenic processes like progressive decline in pancreatic islet cells, decreased insulin secretion, and inadequately suppressed glucagon secretion. So, um, which will lead to like the other one is diminished tissue response to insulin or insulin resistance is there. Anyhow, the definition of diabetes can be remembered by this way, that it's a syndrome. Okay, like if I have to classify, you can say define what you can say diabetes mellitus, I will be defining it like by this way. Sorry, new slide. Okay, so I will be defining by this way that it's a syndrome. Okay, syndrome is of course like sorry, wait. Okay, it's a syndrome of disordered metabolism. Okay, and hyperglycemia. Okay, so one thing, by the way, like in the body, the hyperglycemia can be any time. Like for example, your body can go into hyperglycemia at any time. Okay, so it's a syndrome of disordered and metabolism, and or you can say inappropriate hyperglycemia. Okay, secondary to um, either absolute or you can say relative deficiency of insulin. Okay, uh, either this thing, and see, when the deficiency of insulin is absolute, what it means, like the insulin is completely absent, which is what is the case of you can say type 1 diabetes mellitus, right? But when the deficiency is relative, that is like the insulin is there, but like it is low in quantity. So that is what is in the case of type 2 diabetes mellitus. But type 2 diabetes mellitus have one more thing, that is uh, there is resistance to insulin. So you can add one more line, or a reduction in effectiveness of insulin. Okay, so this is the complete definition of you can say if I will define diabetes mellitus. Okay, so why this is, you can say, a complete definition of diabetes mellitus, like both type 1 and type 2, because this one is telling you like including both scenarios, or three scenarios, type 1, type 2, and also type 2. So anyhow, let's move forward. What happens is basically how people get diabetes mellitus is you can see it's like in type 1 diabetes mellitus, this is a classification, right? Type 1 diabetes mellitus, there is beta cell destruction. Okay, so what happens is like insulin is absent. Okay, and what happens in type 2 diabetes mellitus, like either the insulin secretion is defective, or either there is a resistance. Okay, now there are other types of diabetes mellitus, guys. This is not an important thing at all. And there is something gestational diabetes mellitus, and what you are going to do is you will cover this topic in gynae. Okay, and gynae obs. So why? Because these are the females who are not diabetic before, but when they get pregnant, they got diabetes. So like this one, of course, when it is diabetes mellitus. So what it means, like uh, they have increased sugar level in the blood, but while they are pregnant. Okay, so you can see over here, type 1 diabetes mellitus is simply due to beta cell destruction, and of course, like when there is complete absence of insulin. So you need insulin uh, to 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 treat it. Okay, to treat this condition simply. Okay, so you need insulin to treat this, and what happens in this one is like there are autoantibodies, and these autoantibodies like anti-GAD antibodies, or there are many other defined as well, okay, which basically go and destroy the beta cells, and so they cannot make insulin. And there is type 1b, which is absence of autoantibodies. Like in that case, of course, as we don't know the cause, so we call that type as idiopathic. Okay, guys, one very important point here is to remember, like, type 1 diabetes mellitus, the onset is in the young age. Okay, most of the time, like, these are the young people who will get this thing. Okay, mostly uh, less than 30 years of age, sometimes in their teenage, sometimes very, very, very young uh, pediatrics, like babies. Okay, so type 1a is when there is presence of autoantibodies. Type 2 1b is like simply we don't know what is like what have destroyed the beta cells of in the pancreas, and so we don't know like what is causing that, so that's why it is called as idiopathic. So type 2 diabetes mellitus is the most common. As I told you, 90% of the world population, they have this type. Okay, it is also, you can say this thing as adult onset. Okay, because these are the people who get diabetes later in the life, and either like for example, their pancreas cannot meet up the body requirement of insulin, or either the body is resistant to insulin. Okay, and it is not known exactly what is the causative organism of the, or causative things of for this thing, but uh, like it behaves in this way. So now what I will be doing is like I would like to make a new slide over here. Okay, and I would choose this slide to be you can say in two sections. Okay, mm, two sections with two contents. Okay, so for example, if we have to you can say talk about the differences between the type 1 and type 2, I think that's very important to know. So if we will compare, you can say compare type 1 with type 2. Okay, 2 diabetes mellitus. So what are the things we can do here? So this one is, for example, type 1. Okay, and this one is, for example, this one is type 2. Okay, so what I will be doing is like I will write down the points of type 1 here, and I will write down the points for type 2 here. Okay, and so first point, which is very, very, very important, I already talk about that. Like most of the time it is less than 30 years of age, and most of the time this one started after 40 years of age, which doesn't mean like you are safe between 30 to 40 years of age. You can get type 1, type 2, any like between these two ages as well, but it is like that's why most commonly we use the word. Now type 1 is more common in Caucasians. Okay, less common in like Asians and Africans and others. But sorry, type 2 is more common in Asians and Africans. Okay. Now type 1 is, as you know, it can be due to autoimmune conditions. Okay, like the presence of autoantibodies. And type 2 because type 2 can be due to weight gain, um, can run in families, can like there are many things which they found, you can say, which can cause type 2 what you can say type 2 diabetes mellitus. So you can say simply it is multifactorial. Okay, we will talk about that. Multiple factors are involved, so multifactorial causative causes there simply. Okay, so what they found that type 1, there are certain genetic makeups like human leukocyte antigen or MHC complexes, like DR3 and DR4 are the people who are having increased chances of like this genetic makeup, like they will be getting type 1 diabetes mellitus. And what happens is they found, like for example, if there are two twins, okay, so if one twin have this condition, so there is 30 to 40% chances like the other twin may be having this thing as well. Okay, but twin correlation in this one is less than type 2, because if one twin have type 2 diabetes mellitus, there is 70% chances like the other twin will be having 70 to 90% that the other twin will be having the same condition. Okay, it is like simply more familial, you can say, correlation, like because it runs in families. The type 2 I'm talking about. Okay, and the third point, of course, it's very long. I'm not going to write over here, but what is the pathophysiology behind this, and behind that is basically, in this one there is beta cell destruction, there is no insulin at all. And when there is no insulin at all, of course, what is going on? And simply, it is believed, uh, again, lot of studies are still going on. They are finding most of the things. What they found is, like there are many factors like viruses and infections and things like this, which you can say increase the destruction of the beta cells. Okay, um, like this way. So anyhow, like these are the a few differences you can say in type 1 and type 2. Okay, and going on like further, see type 2 diabetes mellitus, see there is obesity, hypertension, strong family history, sedentary lifestyle, lack of exercise, alcoholism, smoking, western diet, advancing age, diabetogenic drugs, low birth weight, artificial or cow milk formulas and neonates, virus. So like they found a lot of what you can say, um, things, okay, in type 1 and type 2 diabetes mellitus simply. So coming back to this table, what we were talking about is like the genetic makeup and all this stuff. Now, uh, when, for example, uh, uh, in type 1 diabetes mellitus, um, like whenever the beta cells are destroyed, you will suddenly found like the insulin level in the body is going down, as well as the glucose level in the body is going up. Okay, so once the cells are destroyed, there is complete insulin, what you can say, uh, absence. Okay, now, whereas in type 2 diabetes mellitus, what happens is, the beta cells try to compensate the insulin production in the start, and they keep on producing, you can say, uh, insulin. Okay, in type 2. So there is like some time when, what you can say, the patients, they will be having some abnormality in the blood glucose level, but later on, of course, like the insulin level goes down and the glucose level goes up. Okay, so this is what you can say, uh, one of the difference in these two. Uh, Talking about the risk factors, most of the cases in type 1 is due to autoimmune conditions. So these are the patients you will find more other autoimmune conditions. Guys, remember this thing. Whenever anyone have one autoimmune condition, there are increased chances like they will be having other autoimmune conditions as well. And in their family, you will find the family history of autoimmune condition. What are the autoimmune conditions? There are many, like Graves' disease, like recently we have covered, that myasthenia gravis is there. Okay, and celiac disease, for example, is there. Okay, uh, like I'm talking about celiac disease because the we already covered that part, GIT, and pernicious anemia, for example, because many medical students, they know about pernicious anemia. Okay, because they study this pernicious anemia in their first year. Okay, like physiology, talk about this one. So you will find like other things as well. Whereas like in type 2 diabetes mellitus, or you can say like these are the risk factors. Anyone, or for example, anyone who have these conditions, okay, they predispose the patients to get type 1 diabetes mellitus. And on the same side, for example, anyone who have uh, first degree relatives having type 2 diabetes mellitus, they are having higher chances of this thing. And many which I show you, obesity, hypertension, sedentary lifestyle, okay, the type of food they eat or eating habits, simply all this thing, race, if you are, what you can say, Asian or African, of course, like you are at increased risk, simply, okay. Certain medications, and like there are many, okay. So most of the people with type 1 diabetes mellitus, you will find them that they're thin, okay. uh, Thin, or you can say their BMI maybe is less or normal, okay. But most of the type 2 diabetes mellitus patient, when you will see in your life, what you will see is their BMI will be high, okay, or simply they are like overweight type of people, okay. One of the differences between these two, of course, like maybe you will not understand now, one of the complication of type 1 diabetes mellitus is DKA, diabetic ketoacidosis, whereas one of the complication related to type 2 diabetes mellitus is called as uh, HONC or HHS, hyperosmolar hyperglycemic state, okay. Hyperosmolar hyperglycemic state, what you can say, state. And treatment is also simple, like in this one, because there is complete absence of insulin, you have to provide insulin, whereas this condition, you can give certain drugs which can increase the level of insulin, or which can decrease the resistance of insulin in the other parts of the body, okay. So I think that's pretty much about the what you can say, the differences between type 1 and type 2 diabetes mellitus, okay. See, urbanization and westernization, like this guy have higher chances of getting which type of diabetes mellitus, type 1 or type 2, for sure type 2, okay. Now, gestational diabetes, as I told you, you are going to cover this thing in gynae ops, and these are the people who are having, what you can say, who are not diabetic before getting pregnant, but like during pregnancy, there are the release of many hormones, um, which basically increase the level of glucose in the blood, as well as decrease the resistance of insulin in the tissue. So, due to hormonal changes. But one thing, guys, remember this thing: anyone who have gestational diabetes, they are at increased risk of getting diabetes later in the life, and that's the reason. Even after pregnancy, what they do is like they keep on screening them for glucose, like higher level of glucose. So this thing is I wanted to explain. I'll leave this part for now. Um, okay, and now you can see here, obesity lead to insulin resistance, okay. And what happened is, like, there is hyperinsulinemia, like high level of insulin in the blood, which causes impaired glucose tolerance, okay. As well as you can say, uh, like this is the stage, like after that, like there is decreased, like beta cell get defected, and the decreased insulin secretion is there, which we call it as early diabetes. And when the beta failure occurs completely, we can call that condition as late diabetes. Again, you can see over here, like again they are showing you, at this point there is insulin resistance occurs, and see, hyperinsulinemia is there, keep on increasing to the point it will reach when there will be pancreatic or beta cells get exhausted, and they cannot produce more insulin. So see, the insulin level will start going down, whereas the glucose level will start going up, okay. So there is insulin resistance, and because of that insulin resistance, the cells, they don't respond to what you can say, the insulin. uh, Pancreas keep on producing more and more and more insulin, and there's a point when they get exhausted and suddenly drop down, and the glucose level get increased, okay. This is the condition in which we will go to the clinical features later, but first we will discuss the diagnostic criteria. Okay. Uh, why? Because diabetes uh, have huge ways of presentation, and again, one more reason is what, like, many of the times we screen the patients. Okay, and when we screen the patients, then what happens is, like, we can diagnose many people without having any symptoms, and by the way, many people, they don't have any symptoms. Okay, but still they get diabetes without any symptoms, and then they get uh, like they get surprised, like, why, when they don't have any symptoms, but the doctor is saying like they have, what you can say, uh, still they have diabetes mellitus. I will talk about like how we can manage these conditions, but get yourself familiar with something called as impaired fasting glucose. Okay, you can say these are pre-diabetic conditions. Okay, okay. What I am discussing is pre-diabetic conditions. Okay, or simply, you can say someone at this stage. Okay, there is one term called as fasting, impaired fasting glucose, and there is one more term called as impaired glucose tolerance. Okay. Okay, the short form, like how they write it, this one is as IFG. Okay, and this one is IGT. So impaired fasting glucose and impaired glucose tolerance. Okay, what happens, by the way, there are many people. Uh, okay, what is fasting glucose and what is, I'll tell you first of all this thing. Whenever we eat something, anything, okay, for example, if you will drink, if you will take a candy now or a juice now, once it will be absorbed in your blood, okay, that glucose, your blood glucose level will go high, and once your blood glucose level go high, what will happen, that insulin will be released to decrease that glucose, or to make the glucose to enter into the cells, as well as the liver to make more and more glucagon. So what happened is, um, there are people, okay, when we check the blood glucose level early in the morning without eating anything, okay, we call it as fasting blood or plasma glucose. Okay, like this one is like without eating anything early in the morning, or simply one more definition is what, like when you have not taken anything for the last 6 to 8 hours. So this is fasting blood or plasma glucose. One thing is called as random plasma glucose levels. What is that? Like, for example, if I eat anything now, okay, and I will go to the hospital like after 2 hours, and I will say that, please check my glucose level. So what they are checking at that time is my random blood glucose level, like randomly. Okay. So, fasting blood glucose level is, or plasma glucose level is, when someone have not taken anything for the last 6 to 8 hours, whereas random is like you are going over any period of time. Okay, once you will check any one glucose level, okay, fasting, and the level come between 6.1 to 6.9 millimole per liter. Okay, we call it as impaired fasting glucose. If it is less than this, it's normal. If it's more than that, I will tell you that's the diagnosis of diabetes. Okay, so that's why anyone, like, after 5 minutes you will understand everything what I'm saying. because when I will discuss the diagnosis of diabetes, anyone who have the level between these two, okay, that is called as impaired fasting glucose. Okay, what is impaired glucose tolerance is what they do is they give you 75 gram of glucose by mouth, okay, and you can say, and wait, and yes, and they check the level of glucose in your blood after 2 hours. Okay, so this test is called as oral glucose tolerance test, OGTT, oral glucose tolerance test. Okay, now what's the importance of this thing? Okay, um, anyone in which their levels come between 7.8 to 11.0 millimole per liter, that condition is called as impaired glucose tolerance. Okay, because less than 7.8 is normal, or more than 11 is diabetic condition, so that's why remember these values. Okay, so these are two things which are pre-diabetic conditions. These people are not labeled as diabetic, rather they are called as pre-diabetic. One more thing now, which is the last thing to discuss in this part, that is called as HbA1c. Now, what is HbA1c? It is glycosylated hemoglobin. Simply the glucose which is present in our blood. Okay, much of that glucose basically is binded, you can say, uh, with hemoglobin. Okay, or simply this is the glucose which is circulating in the blood, and it is bounded or linked with hemoglobin. Okay, and it is circulating in the blood. And where is the hemoglobin? Hemoglobin is in the RBCs. Okay, so that's the reason you can say that, for example, if you eat something now too much sugary, so of course your blood glucose level will go high. Okay, but these RBCs, which are glycosylated with glucose, they are circulating in the blood. Okay, and as RBCs have, you can say the lifespan is around 120 days. Okay, or the life cycle of the RBCs is too much long. So what they do when they want to check someone glucose control, or the level of glucose in their blood for a long period of time, okay, or how you can say better the control was over the last few weeks, okay, they check this one. Okay, they check glycosylated hemoglobin, and anyone whose glycosylated hemoglobin level is between 6.0 to 6.4%, it is also a pre-diabetic condition. Okay, guys, why I'm telling you this thing, pre-diabetic conditions, without discussing diabetes first? Because many of the people, first of all, they develop this condition. Okay, so either they develop impaired fasting glucose or impaired glucose tolerance. Okay, so anyone who have these values coming out in their blood, it means they have higher chances to develop diabetes. And to tell you more about that, okay, I will tell you more about that is, um, 1 to 5% people who have pre-diabetic condition, or simply whose blood values are this, every year, per year, okay, they will develop diabetes mellitus. Okay, this is the stage when you can do your best, educate the patient and save them from diabetes by lifestyle modifications. Okay, which can be anything, which can be anything like exercise every day, lose weight, okay, or decrease their weight, okay, and many other lifestyle like quit smoking, physical exercise, and all this stuff, okay. So anyhow, like that's why I'm telling you these what you can say these conditions are important. You understand, like these values and everything. When we check this one, this anyone blood values come under this you can say ranges, it means like they have pre-diabetic condition, and we tell them, you are pre-diabetic, and if you're not going to change your lifestyle, okay, so it can quickly change into diabetes. So this thing. Now see, like this one, testing for diabetes in asymptomatic people. Consider testing in overweight, obese adults like whose BMI is more than 25, okay, or with one or more additional risk factor like uh, if someone is more than 20 45, you can test them, okay. If tests are normal, repeat testing at least at 3 years interval. Use HbA1c in fasting plasma glucose at 2 hours, 75 gram oral glucose tolerance test, okay. And simply anyone whose values come back as these, as I told you, we tell them that they are in pre-diabetic condition, okay. Now when we label anyone with diabetes, here is your answer. Okay, I put both values here. Guys, see, these are milligram per deciliter, like the values which are written above, and like here, you can see this one, and these are millimole per liter, like the values which are written downwards, this one, okay. So I'll be talking just about uh, millimole per liter, of course, okay. And this is HbA1c, glycosylated hemoglobin. Just not to confuse you, I must add HbA1c, okay. A short one is form as HbA1, A1c. What is the diagnostic criteria? Okay, of course, like this one is defined by many health organizations. Okay, and this is okay. See, anyone whose values are, you can convert this 100 milligram per deciliter to millimole per liter, and what will happen is like you will get the same values which I was talking about before. So anyone whose values like of fasting plasma glucose level, I will write just not to confuse you, FPG or fasting plasma glucose level as more than 7, where you can see over here 6.9 it is impaired fasting glucose. So anyone whose level is more than 7, diabetes. Anyone whose 2 hours oral glucose tolerance has come back greater than 11.1, or random blood glucose, of course they're the same thing, or anyone whose HbA1c um, come back, see, if you can read over here, I will bring back, see, 6.4 up to 6.4 is pre-diabetic, so anyone who have more than 6.5 or 6.5, like this is the diagnosis of diabetes, okay. So any one of these things, okay, any one of these things, either this you can do, 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 okay. uh, this thing is important. And guy, you know uh, if anyone has symptoms, which I'm going to talk about them soon, and their values come back as this is the diagnostic, this is the diagnosis of diabetes. But anyone who don't have symptoms like polyuria, polydipsia, whatever, anyone who don't have symptoms, then you have to do a repeat confirmatory test, okay, just to make sure that yes, the values on repeat tests came back as high as well. So listen again, anyone who don't have symptoms, you need at least 2 tests. Anyone who have symptoms, one reading is enough, okay. So this one. Rest, like I told you, what are the causes already we discussed. Okay, um, there are many conditions, for example, which can give. Okay, this is like the comparison between American Diabetic Association as well as WHO in the diagnostic criteria. Okay, before going on that, guys, to talk more about, you can say, the causes of type 2 diabetes mellitus. Uh, I will add over here. There are certain conditions, for example, which put the patients on the risk of like for diabetes mellitus. For example, I'm talking about type 2 right now. Okay, that's why I opened the type 2 one. Okay. For example, pancreatitis. Okay, pancreatitis. Of course, inflammation of pancreas. Of course, this is going to destroy the pancreas. Okay. Anyone who have hemochromatosis. This is a disorder of iron metabolism in which iron started depositing in different parts of the body, the joints, the liver, the eyes, everywhere, right? So it can also deposit in, uh, you can say, pancreas and can give diabetes. It also get deposited in skin and impart a bronze color to the skin. So that's why it is also called as bronze diabetes. Okay, hemochromatosis I'm talking about. Many endocrinological conditions can give diabetes, like acromegaly can give. Okay, Cushing syndrome, like which will be our next lecture. It will give diabetes mellitus. Okay, as well as for example, someone have glucagon, glucagon, like which increases the blood level of glucose. So anyone who have a tumor of that, glucagonoma. Okay, there is insulinoma as well. Insulinoma, of course, it will give you hypoglycemia. Okay. There are many others like pheochromocytoma, hyperthyroidism. Okay, many drugs can give type 2 diabetes mellitus as well. For example, using steroids or glucocorticoids, okay, can give, as well as uh, beta adrenergic drugs, okay, phenytoin, clozapine. Phenytoin is given for seizures, epilepsy. They found like some infections like rubella, CMV infections, and some okay, Down syndrome people, they are at risk of getting type 2 diabetes mellitus as well. Down syndrome, Klinefelter syndrome, Turner syndrome. I think you guys already go through them in pediatrics, right? So I hope like until now what I'm talking about you understand, and of course like these things they need more and more and more, what you can say, discussion. Okay, so coming on the sign and symptoms of the clinical features of type 2 diabetes mellitus, guys. Okay, um, see, many short books, they just say polyuria, polydipsia, polyphagia. What is polyuria? You have to urinate more and more. What is polydipsia? You will keep on drinking more and more water. What is polyphagia? You will keep on eating more and more. See, what's going on, by the way? Your blood glucose level is higher. When your blood glucose level is higher, your kidneys want to throw uh, more and more glucose out. With that, they are going to throw more and more water out, and because of that, you will feel more and more thirsty. You will keep on drinking more and more water, and because your glucose cannot enter into your cells, so you will be energy deficient and you will eat more and more food. So these are the three classical symptoms of diabetes. But this is not the only thing you have to know, because we are studying it from medical point of view. So clinical features you can see over here. This one is the clinical sign and symptoms of type 1 diabetes mellitus. See, polyuria, increased urination; polydipsia, increased thirst; or polyphagia, increased hunger. Okay. Type 1 diabetes mellitus people, they lose weight, they feel fatigued, they have increased chances of infections. Even type 2 diabetes mellitus, when their glucose level is high, uh, in females especially, they get more vaginal infections. In males and females both, uh, whenever someone have any wound, for example, there is a delayed healing in that, and things like this. Okay, now guys, it's not like this that all the people they have polyuria, polydipsia, polyphagia. Many people they never know they have diabetes. They are diagnosed once we screen them. Many people, the first time they present to the hospital is with some complication like DKA. Many people they present to the hospital like with some unhealing wound. Like I have seen patients in my life, in their sugar levels are way higher, and they feel completely normal. They don't feel anything. Okay, so uh, simply everyone have its own, what you can say, um, like presentation. See, sedentary lifestyle, she's eating chocolates. Okay, she's having antihypertensive, okay, and anticoagulogenic drugs. Okay, she have a blood pressure curve because which shows like she have hypertension. She's obese. She is having sedentary lifestyle. She's having multiple wounds and she have multiple infections. Okay, you can see over here. So they feel fatigued, they're low in energy, they have recurrent infections. Okay, now like these are the clinical features, and clinical features are not so much, but what is too much is the complications. So I believe like we must go first, you can say, on complication. I think we must discuss treatment first, and then we must go on complications. Okay, so um, treatment of diabetes will be discussed in the next lecture. Okay.